Morning, everyone. Um, I've just been to see my surgeon again about maybe later on down the line having my spleen removed if the treatment works, but there are still far too many risks. If the treatment stays clear after 6 months, I've got another 3.5 months to go on the treatment. I get the all clear after the 6 month test, I'm going to see him again. But he said to me then, he is a transplant surgeon, and he said to me then he would not operate on me. He said with my blood disease and everything else, it's way too high risk, way too high risk. So no matter how much pain I'm in, uncomfortableness, I'm going to have to wait until such times as if I get a liver. So my treatments, I suppose, going very well. I'm SVR. Side effects, hair loss. Not so much from my head, but the rest of my body. So we're all nudie naked little babies, if that makes sense. Bits, bats, and otherwise are all uncovered. Gross thought, I know, but there you go. And I've heard that several other people have this with some of the treatment. So it's not the ribavirin that causes that, because I don't take ribavirin. I'm also getting very, very bad headaches. That's not helping at all. Headaches are really not helping. It makes me feel very nauseous. I don't have an appetite to eat. But what I have noticed is a change in my personality. Where before, yes, like everyone else, I have my ups and downs and everything. But before, it took a lot to get me angry, a real lot. I am getting very snappy, very bitchy, and it's not me. Not when I'm flipping over stupid things that normally I would genuinely laugh off. I'm finding memory flashbacks. And when I'm sleeping, it's like I'm actually living them. That's the only way I can explain it. I'm actually living that memory. It's not just I remember when. I can feel it. I know what the fear was. I know what I was scared of. I know the hurt, the anger, everything I felt at whichever negative time in my life. I can actually feel it all again. It's been very, very prominent. Now, I don't know if that's part of the treatment. I presume it is, because I haven't had it for years. In fact, I spent many, many years coming to terms with my demons through lots of ways. And I've managed very, very well, considering there was a lot of demons. Oh, excuse me, gas again. But it seems as though this treatment, the longer it's going on, is starting to trigger memories, not that I've forgotten, but that no longer bother me. They're starting to bother me again. That's the only way I can explain it. Definitely vivid nightmares. Absolutely vivid when I do sleep. It's like going to the movies. It's not one of these dreams that's black and white. It's like dreaming in Technicolor, and I'm actually there, and I'm preempting, and I'm even dreaming that I'm asleep, and in my sleep I'm waking up, but I'm still asleep, if you see what I mean, if that makes sense. I'm asleep in my dream, and I'm watching myself sleep, and I'm watching myself dream. And my brain, in other words, is so very active because of this treatment. It's not giving me any rest, and that is getting me down. The depression side is taking me to not very nice places. But I will see it through. I'm not going to give up just because of the mental torture, as hard as it is. I try very hard not to take it out on other people, which sometimes works and sometimes doesn't. But thankfully, most of the people around me know me. Now, I'm going to touch on a subject today that is very close to a lot of people I know. And I got a couple of pals, Jimmy and Hilda, and I know they have a problem with this, with having HepC. Stigma. Social stigma. Nasty word. And it can cause many, many, many nasty reactions. It can cause depression. I can understand why people don't want the public to find out that they have this disease. But I also don't want this disease to win. So my way of combating the stigma is, if people say to me or give me an impression, which we've all probably had, that you feel dirty, whether you've got AIDS, HepC, whatever, HCV, you know, it doesn't matter what we've got. We were all given dirty diseases, as far as the public eye is concerned. And the public are very ignorant. Some of our families can be ignorant. Some of our friends can be ignorant. I'm lucky most of my friends and family wanted to know how they could help. And I said, don't stop talking about it. If you have any questions, ask me, and I will answer you honestly. I don't hide behind my disease. I'm Sally Vickers. I'm not HepC, whose name happens to be Sally Vickers. Does that make sense? I know a lot of people can't because of their jobs and so forth, because of this nasty word stigma. So how do we overcome stigma? I think everyone has their own way of doing it. I just totally defy everybody and everything, and I say, you know, if you don't like the way I am, there's the door. I don't care if you're family. I don't care if you're friends that I've known for a long, long time. If you can't accept that I was given this disease through no fault of my own, and you can't back me up when the times are hard, then get out of my life. Fool me for having you in my life. It's my fault for having you in my life. If you're any way destructive to my life, you go. We have enough pressures with stigma in society. We don't need it with the people of family and friends in our life as well. We've all been there. We've all had the people give us those looks, whether they be in the medical profession or family or in the streets or whatever. I had to, certain members of my family, I had to explain, yes, you can touch a bottle after I've touched it. Mine is only blood-borne. You can only catch it through blood-on-blood contact. Saliva if you drank 50 pints, you know, or very, very, very rare to get it through sex is HepC. I've had medical people look at me and double-gloved and triple-gloved to take a blood test. I've had people refuse to take blood tests of me because I've got HepC, and that's medical people. I think it's absolutely disgusting. I think there is a lot more tolerance in this day and age, and I think some of us get trapped in the past where we still think we are dirty. We are not. We're not dirty. So what society thinks. I know jobs, etc., that's notwithstanding, but I mean in general, does it really matter what they think? Those who are closest to you and who love you and accept you for who you are, they're the people you need in your life. I have seen people crushed by the stigma. I remember when the doctor told me I had hepatitis C. Excuse me a moment. And I'm not Christian bashing here or anything else. It was a very Christian surgery, which I'm not. I'm not particularly anything. If anything, I'm almost like a pagan-y, witchy thingy, my bobby-doo. Anyway, he actually turned around to me, sat back in his chair, he said, I'm sorry to tell you, you've got hepatitis C. And that hit me like a brick, because I knew about Hep C, having worked with addicts. And he also said to me, did you get it through sex? And I looked at him like he was absolutely nuts. Because not only was I given Hep C, I was also given an STD. which prevented me from having children, which forced me to have a hysterectomy. Therefore, I couldn't have any children. Thanks. So I had that stigma going on as well, of an STD, as well as having HepC. I just looked at him, I said, if you'd care to check my records, I bet it's the transfusion I had in da-da-da hospital, in da-da-da year. And he looked, he went, why did you have a blood transfusion? Now, I was born with this blood disease. And for years, doctors have told me, no, 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 no. And he went, oh, you did, didn't you? I went, yeah. The only records of mine I have missing are the ones of when I was in Hammersmith Hospital in London, and they gave me injections in the legs to stop or to help with the clotting. Now, I've never had trouble clotting, and all of a sudden those records have disappeared. I've had plasma, I've had whole blood, and I've had products. But what they've done with me is they traced the damage of my liver, traced it back, and worked out, assessed how many years it would take to get my liver to be that damaged. And it worked out to the 1982 transfusion. As I said, I got HepC and an STD that made me infertile. Wasn't fun, was very difficult. I felt very dirty. I felt more dirty with the STD than I did with HepC, probably because I knew a lot about HepC. I knew more about the doctors at that time. We all probably still know more about it than doctors at that time. But, you know, people say, they actually ask me, are you terminally ill? Well, depends which way you look at it. If I get a liver, chances no. If I don't get a liver, then yes. So are we terminal? I don't know. My doctors won't put that label on me, which in one way I'm thankful for, because I think once a doctor tells you you're terminal, if they're not sure, you know, unless like some people, bless them, have terminal cancer, etc., that is terminal. But when you can, there is hope of a reprieve, even if it's a new liver. You can't be terminal, in my eyes. So I don't like to think of myself as terminal. I know some people have been told they're terminal just because they've got HepC and cirrhosis. That's not necessarily so. You know, I'm thinking of my dear friend Jimmy. And again, Hildy. You know, they've been told terminal. You're not terminal. To tell someone they're terminal, I think, is a very, very difficult thing for a doctor to do. But unless they're absolutely point blank certain, which I don't think anyone can be, not realistically, they can give you, not with cirrhosis anyway, all the time you've got a chance of having a liver, and I'm not talking about cancer or anything else, I'm just talking about HepC cirrhosis. Get this right, being terminal with HepC cirrhosis. It is not a terminal disease because we can get a liver. If we don't get one, or they can't find one, then we get terminal. But all the time there's a chance we might get one, we're not actually terminal in the respect of they can't cure us. I've got terminal HepC, but it doesn't mean I'm terminal. My HepC is terminal because it will never go. But I personally am not terminal. Is that picking it apart? I don't know. I just think it's wrong to tell people they're terminally ill, which takes away any hope for them, when actually they're not terminally ill. They're very, very sick and they're very, very poorly. But they're not terminal because they might get a liver. And if the virus stays away or stays suppressed and they get a new liver and it works, then how are you terminal? Think on it, please. Especially Jimmy. You know, think on that. It's a bit of glimmer of hope, you know. Instead of thinking, I'm not going to make it, I'm not going to make it. Yeah, you probably will. with a bit of luck. We all need a bit of luck. But nothing is cast iron. Nothing is set in stone, Jim. Nothing. You know? So try and, understand that. And stigma, Stigma drives us to be ashamed. I can only talk for myself. All right, I'll put it this way. Stigma drove me to be ashamed. For a while. Not for too long, but for a while. Was I frightened of telling people? Not my immediate family, no. Because I've got a very loving family and they would just accept it. And they did. I had to explain what it was and why I got it and da-da-da-da. They just got angry, which most of our families do, and decent friends. Alan and I, my husband and I, obviously we have separate flannels, separate towels. I get them with the name embroidered on them so we don't get confused. Because at the moment, like I've got a cold sore on my lip. Now if that splits and I'm washing my face, I get blood on the flannel. If Alan uses the flannel and he's got a cut, then he can pick it up that way. These are sensible things that you have to look at. But where people get unreasonable is, you're not going to catch it by me passing you that. Ignorance. Stigma comes from ignorance. And how do we get rid of stigma? We educate people. And people who don't want to be educated about it, you're not being in my life. We have enough to cope with on a daily basis, with everything that's wrong with us, without putting up with your little, oh, you can't touch me, oh, I don't want to kiss you, oh, don't hug me. And it's a load of bollocks, to be honest. Absolute load of crap. So stigma makes us feel, or made me feel very dirty. And I said it wasn't so much the HepC with me, it was the STD. I felt so ashamed. I can't explain how ashamed I felt. And every time I went to the hospital about it, and obviously eventually I'd had to have a hysterectomy, I immediately told them, but I got it through a blood transfusion. I was terrified of them thinking that I was like sleeping around or real tart or whatever. Because that's the looks you got, even from the qualified nurses. I've had nurses tell me, well, we won't get a good reading off you because you're too fat. And exactly those words. Maybe. But you don't have to speak to me like that. And as I said, I've even had blood nurses refuse to take blood. In fact, I reported one. One of my nurses told me somebody, she's my practitioner nurse, down at the GP practice. She's lovely, one of my nurses. And she took my blood, and when I had my leg ulcer, because I got a leg ulcer, and boy, did that take a long time to heal without problem. And I've still got a very big looks like a black hole in my leg, but it's healed. But my skin is, I don't know if anyone else gets this, your skin is paper thin, like rice paper. And that is part of it, apparently. But she told me she once was working in a ward and they had an AIDS patient in there. She went in to take the bloods. And this other nurse said, I'll be back in a minute. She went, okay, because they had to have two of them there. And she came back in and she was fully kitted out. Mask, bodysuit. And she said, well, what on earth are you doing? She said, I'm not touching him, she said, without full protection. She said, you're only taking blood out of him. This is how she was horrified. She was disgusted. She said, all you had to do was double glove. She thought she could breathe it, and this is a nurse. And they wonder why it hurts us. Stigma's a terrible thing. But in a way, stigma can make us stronger. Or it's made me stronger. Because in the end I thought, well, it's not my fault. Why should I get stigma for something that was given to me? To me. I didn't do this to myself. They gave us this, so why should we suffer the stigma? I only suffer stigma now if I allow people to do it to me. I don't. I tell them point blank, if you don't like it, get out my life. Some people will agree with me, some won't. But this video is not for everyone. I specifically done this for my friends Jim and Hildy. And I know he's having a hard time. And, well, they both are. And my heart goes out to you. But, you know, what's in the past is in the past. We can no longer change that. We can't alter it. We can't do anything about it. What we can do is alter where we are now. And yes, I was a bit disappointed when the surgeon told me this morning that he wouldn't operate anyway, it's too dangerous. But I'd rather a surgeon tell me the truth than put my life at risk. And no, it's not dangerous just because of my size. That's the least of the worries. Mine is to do with my blood condition, my genetics, everything. And he said, way, way too dangerous. He said, sometimes the best thing a surgeon can do for their patient is not to operate. He said, as in your case. I really was hoping if the treatment is successful in 6 months down the line after I finish, that they might be willing to risk it. He said, no, not even then. He said, because your spleen's just going to get more and more inflamed, as dead as it is. He said, because the cirrhosis is just going to aggravate it more and more and more. So as time goes on, it's going to get more and more dangerous. So I will be battling with Alan, with the council now, to get moved because it's getting far more dangerous as time goes on. So anyway, this is my first video for a while. Sorry if I waffled a bit. But I just wanted to get that out there, you know. There's a couple of people maybe needed to hear a couple of things and know that they're not alone. All right, I love you guys. I'll be doing one later, but I'm going to be doing it on, again, EHMs, extrahepatic manifestations. But keep it up, all you guys. Good work. And let's roll on 2016 to a better year for all of us. Love you. Bye.